The Live Healthy Louisville podcast is brought to you by Results by Design Fitness. At Results by Design Fitness, we pride ourselves on one main goal, and that's to change more lives. We do this by impacting one person at a time to make sure that they change the way that they look, think, and feel when it comes to fitness and creating a lifestyle. In today's society, there's a lot of misinformation and just flat out bad advice when it comes to fitness, and we're here to change that. Throughout the episodes, we'll be speaking with the best personal trainers, physical therapists, health coaches, and more on a podcast that's designed to get great information to you. So that way you can change the way that you look, think, and feel when it comes to fitness and sustaining a healthy life. Episode 1. I'm a little nervous, but I'm also excited to bring you the Live Healthy Louisville podcast, brought to you by Results by Design Fitness, where we aim to change more lives. And that's the main goal of this podcast, to find you who are listening, who might feel scared, might feel intimidated, might feel like you don't know the answers because there's so much misinformation out there in this world. The Live Healthy Louisville podcast aims to bring you the right information with the right people. I've been blessed over the years, thanks to Results by Design Fitness, to meet people who have changed the way that I think, feel about fitness and about living a healthy lifestyle. And I thought there was no better place to start than with, maybe a little biased here, my favorite physical therapist in the city of Louisville. There's no one better when it comes to information retention. There's no one with a better drive when it comes to educating themselves. There's no one better when it comes to connecting with people and bridging that gap between quality information and service. I'm also married to her. It's my wife, Allie Harper, a doctor of physical therapy. She graduated with her doctorate from Bellarmine University. She actually also worked at Results by Design Fitness for a short stint as a part-time coach, which is where we met. And we quickly found out that we were like-minded when it came to not only our morals and our values, but also how we felt about healthy lifestyles and how we felt about leadership and service as a passion of ours. So it gives me a great honor to welcome my wife, Allie Harper, Doctor of Physical Therapy, on the Live Healthy Louisville podcast for episode 1. Allie, thank you for doing this for me and with me.
You want to say anything else?
What am I leaving out here?
No, you're good.
Well, Allie, thank you for coming on. I just wanted to give people just a summary of what it's like to be in our shoes a little bit, but also I feel like there's no better person to help me wage this war between misinformation and quality information when it comes to fitness and helping the people in our great city, but also whoever else might listen to this podcast outside of Louisville. So I just want to kind of pick your brain a little bit today. I know you deal with this on a daily basis as far as people coming into the clinic with bad information and just being flat out lied to just because it's sad, but we don't, as professionals as a whole, believe the same things that you and I believe or that our peers believe. So talk to us a little bit about your background, about how you got into physical therapy, why you decided to go into it, and just kind of give us a feel of that.
So I was an athlete growing up. I never had like a significant injury or anything like that, but I remember very vividly one day randomly my dad was like, I could see you doing that, because he had a friend that was a physical therapist, and I was like, yeah, maybe I could do that. And for whatever reason that stuck with me, and I think I just had a passion for exercising and being in sports and athletics, and I knew that would keep me around it. So I pursued exercise science in my undergrad, and then that was a kind of prereq for physical therapy school. So I don't have a fancy story that brought me to it, but that's kind of how I got there.
Yeah, and I spoke briefly on this to open up, but we met at Results by Design Fitness. You were a part-time coach there. Major differences or any big similarities between the fitness realm and the physical therapy realm as far as dealing with patients versus clients and fitness versus rehab? What are some similarities that you see, and how was that transition?
Well, I sought out RxD because I needed more experience with exercise. I mean, I was kind of self-experienced, like I worked out and had a trainer somewhat growing up, but when I started at RxD, it was like my mind was blown every day because of how much information I didn't know, especially when it comes to functional training. So that was really eye-opening and helpful. And I remember how much information I learned the first year when we went to Perform Better and watched all these speakers speak, and they were, physical therapists and chiropractors who were in that functional movement space. And I saw how I could bring that to my own practice. And it's not something we really get in school either, is that exercise component. I mean, a little bit, but I forget what the question was.
Yeah, no, that was perfect. I just how that transition was, and you spoke about learning from those speakers that perform better a little bit, but and then the knowledge you gain by just having experience, and I feel the same way. I mean, anybody out there can get a personal trainer certification. But it truly takes someone who's, really willing to soak up information like a sponge and continually educate themselves and learn from some of the best. First of all, figure out who the best out there are in order to grow and develop and become better. And I didn't realize that getting in. I don't know if you feel, I'm sure you feel the same way. But I didn't realize how deep of an ocean fitness is and health is until I actually got into this fitness world. It's hard to explain. It's something that can only be experienced. It can't really be explained, but there's just something about putting yourself around the right types of people that allows you to grow and develop. So as far as switching into that field of caring for patients, caring for people who are coming in injured, caring for people that are coming in post-op, what has that transition been like for you, and how have you changed the way that you treat versus the way that you may have coached or been a teammate on sports teams?
I think there's a lot of similarities in that you have to motivate your patients just like you would your clients or your teammates. And if you can't get them to feel like they should do what you want them to do, then your compliance is going to be horrible. When that comes to arrival rate and just your relationship with the patient. So I think that's huge. You need to build that trust in the very beginning. And how I do that usually is just trying to over-educate my patients a lot. I explain every single thing I'm doing. And I think some people probably think that's a lot, but it helps me realize, okay, what am I doing and why am I doing it? And then I can see a lot of the time the patient's eyes will just be like, okay, that makes sense. And they're not just leaving the session being like, what just happened? I don't have any information to take with me. I still don't know what's wrong with me. I don't know how she's going to help me. Don't know what to expect next time. So I try to lay that kind of roadmap out when they come in so that they know what that journey is going to look like for them, because they're coming in and they're nervous and they're scared and they're in pain, or they just had surgery and their doctor didn't tell them what to expect from rehab, or whatever. So
yeah, it's kind of like we have these conversations quite often. It's that aha moment, when someone experienced something that they didn't think was possible, or maybe their provider sent them down a path that they thought they were going to have, and then you kind of open their eyes in the right way. We talk about this all the time, but there's a lot of misconceptions when it comes to rehabilitation, physical therapy. Talk a little bit about that type of information where people are hearing one thing, or there's a common misconception that is widely recognized, but it's really not true when it comes to how you treat.
I think most people think you have to be injured to go to physical therapy, or you're old and decrepit. And like even my family members will be like, they just expect that I work with like old people all day. And I work in an outpatient orthopedic setting. So yeah, I mean, I have my 92-year-olds and I love them. And honestly, they are sometimes the most compliant patients compared to my young athletes that when I was in school, it's like, I only want to work with athletes. Like that's a very cool field to get into, but also kind of a niche. And so if you don't have like an in the very beginning, it's going to be really hard, like especially like trainers or PTs that work with like teams like at the professional level. So I work in outpatient orthopedics, so I see ranges from 10 years old to 90.
110.
I haven't had 110 yet. Maybe one day. But
Yeah, I relate to that 100%. You know, when people hear that I'm a personal trainer, they think I'm either working with this superstar athlete or bodybuilder and I'm trying to get someone show ready, or that I'm working with someone's grandma who is sitting on a bench that can barely move, that's pulling on a machine.
Yeah, and I think, I mean, for both of us, I think mostly we're just helping the average person who wants to be healthy or feel better. And honestly, that's the clientele or population that is never going to go away. So like, athletes are always going to be there too, but I feel like from a longevity standpoint, like I love working with the average Joe because I can relate to that. And, they just want to be healthy and be healthy for their family, or to start a family, or to, continue to be with their family if they're older. So I think it's a misconception that, PTs just treat old people. But I'd say another misconception going along the lines of like you have to be hurt to go to PT is not true, because from a movement assessment standpoint, I mean, along with personal trainers, especially like what they do at RxD, because you guys use that, like the FMS screening. But from a PT standpoint, like we're evaluating how you move, why you move that way, and how it might be relating to your dysfunction or your pain. So I don't know why you would want to go to any other provider first for that. For instance, like a medical doctor has a ton of knowledge, obviously, in schooling, but they do not get the same anatomy that, movement, degrees do, like physical therapy, chiropractic trainers, whatever. So I think it bothers me a little bit. I try not to get offended, but when they come in and they're like, well, my doctor said it's this. And I'm like, well, what'd they do to determine that? Because did they watch you move? Did they touch like your insert body part that hurts at all? Did they measure anything? And most of the time the answer is no. Maybe they've had imaging, but I think, most people don't realize that we can be a better diagnoser or kind of assist them in determining what the issue is. But if their doctor told them one thing, sometimes that's hard to change their mind.
Right. Your knee hurts, don't squat ever. And I'm always like, how are you going to go to the bathroom? That's going to be tricky.
Do you get off the toilet? I don't squat.
Yeah. And as far as from an exercise standpoint, the same thing. People think that exercise has to be this super crazy routine where you're sweating and it's just dripping from the walls and you're throwing around as much weight as you can. And I think it takes a quality coach, just like it takes a quality physical therapist, to bridge that gap between movement quality and workout efficiency. So that way we can get you to their goals as quickly as possible, but also keep them safe. Because believe it or not, I don't want to send people all the time to heal something or to get a shoulder replacement. And I think people think fitness, for the longest time, fitness has been this, it's been this crazy event type movement style that has, it's just taken people far away from what it should be. Fitness should be something that gives you life, something that provides you energy, something that allows someone in their 60s and 70s to get up and down off the floor with their grandkids, something that allows someone in their in middle-aged life to be able to still go on hikes, to still go on bike rides, to take their family on vacation and not feel like they're the oddballs left out. And I think that is where we have failed as a community of health, is that we've moved so far away from that point of things, and where it's either one or the other. You're either healthy, or we're going to put you on medication, or we're definitely do not exercise. And we're wasting away our lives instead of experiencing life to the fullest and experiencing what it's truly about. And as far as the people that you see, we both, from an exercise standpoint and a physical therapy standpoint, we've said that we want to create people that live healthy and happy lives. From your experience, from working with people, from the healthiest people that you've been around, from people that truly show that great example of what it looks like to be healthy in their 50s, 60s, 70s, and 80s, what are some habits, some weekly habits that you like to see people create as far as keeping themselves at low risk of injury, but also keeping themselves at a high rate of activity?
So when I'm evaluating somebody, I'm always asking, of course, they have some sort of pain. So I'm asking, what type of pain, describe it for me, the severity of it, what makes it worse, what makes it better. But I'm always asking how they sleep, because that gives me an idea of how severe their pain is if it's waking them up at night. And I think that's usually my first goal, is to improve their sleep pattern if it is waking them up at night, or keeping them up once they are awake. And I explain to them, most people know, like, sleep's important, obviously, but I just say, okay, that's going to be like priority number one, because if you're not sleeping well, you're not healing well. And that might be somebody who comes in with chronic pain, which might give me a little bit more insight. If they aren't sleeping, there might be other factors at play too, if it's chronic pain. But if it's, post-op or surgical or recent acute injury and they're not sleeping because of the pain severity, I explain to them how that can delay healing. So that's one of the first things. And I always ask about hydration too, especially because a lot of people are coming in and, they're having pain, they're having, cramping or whatever it is. So swelling, you name it. So I'm asking about hydration and what kind of hydration, because you can intake all the water you want in a day and you can still be dehydrated cellularly. So I'm usually educating them about some sort of electrolyte supplement if they're not. And most people are not getting enough water, number one, and they're definitely not getting enough minerals. Plus, if they're exercising, which if they're with me, they are, then they're depleting minerals too. And most people are deficient to some degree in that. So that can play a big role in sleep. That can play a big role in pain, muscle function, nerve function if they have nerve pain. So I'm always asking about, sleep, hydration. Diet usually comes into play at some point. I kind of try to get a feel of the person though, because some people are receptive to it coming to PT versus people coming to you guys are probably wanting that advice or information. And I get a little pushback on that sometimes from people. So
it is the hardest part. And it's because you see people for an hour, 2 hours a week. I see people for 3 to 5 hours a week. Mm-hmm. Outside of that, we have no control. Outside of that, we have no influence. Outside of text messages, the occasional call, the emails, the Facebook, Instagram post, anytime they see listening to a podcast. Outside of the gym is where it's the hardest, inside of the kitchen. And so we're exposed to so many things socially, events, birthday parties, games. March Madness is beginning now, and everything that is socially driven to be around food and beverage, and that's the hardest part to control. It is the nutrition aspect, but basically, I'm right there with you. Create a healthy, sustainable plan. Figure out your sleep, because sleep is going to control stress. It's going to also control energy. If you don't have those things under control, you're not going to be able to produce the output in the gym. Mm-hmm. And if you're not getting the input, obviously it affects everything. So, but that is the hardest part is, what are we doing nutritionally? What's one healthy habit we can create right now to be able to push forward towards our goals? Someone who's in pain, someone who says, hey, Dr. Allie, I call you Dr. Allie or Dr. Harper?
I tell them not to call me doctor.
Hey, Allie, I'm in I'm in pain, but I want to lose some weight. I want to be fit. What do I do?
Well, I usually ask what they're doing now, and they'll say, I eat pretty healthy. And I'm like, well, I don't know what that means. So I try to see like what types of foods they are eating, because a lot of them are fearful of, you know, I think they get overwhelmed with how many different diets there are or what they should be doing. And I just try to simplify it like you guys do, which is really probably more so where I learned it from, is just prioritize macronutrients. So prioritize your protein. I mean, especially for people that I'm seeing, because most of the time they are either healing from an injury, healing from surgery, where protein is a must, especially for if we're overcoming muscle atrophy or we're trying to gain strength back from that injury or surgery. And then also, you know, a lot of people are fearful of carbs. So I try to just explain like the healthy carbohydrates and how your body literally runs off of carbs for energy. And if you're not eating enough, that might work for a while. And of course, there's certain instances where certain types of diets where carbs are less can absolutely be necessary, and the research will show that. But for the average person, myself especially, I know I do better with carbs. So someone who maybe has tried the no carb thing and they're still not where they want to be, I'll try to just explain why, you know, choose the right types, whole carbs like, you know, rice, potatoes, you know, not the processed stuff, not boxed stuff. And most people are like, well, you know, that's kind of hard because I have kids and we're always on the go. And I'm like, okay, well, just can you prepare ahead of time? Because that will save you a lot of time during the week, which is what we do. I think it's just hard to get into the habit. So I try to motivate them. I'm not trying to make it seem like it's so easy, because I know it's not, especially if it's something that they're not used to. Because I mean, this is not something I've used to do when I was, you know, growing up, and especially my younger patients at, you know, high school age kids that are post-op. I'm trying to tell them to eat their protein. You know, that's hard for them because they're at school and they don't know how to prepare at home, or they don't have the resources to do that. And the parent's not there for me to talk to them, or, you know, they just maybe don't have the same buy-in.
Yeah, if it were easy, we wouldn't be in the midst of a pain and obesity epidemic. And the truth is, it is tough. But I love the fact that you take a holistic approach when it comes to physical therapy. It's funny, you know, you use your modalities when it comes to helping someone move better, but the first thing you're attacking is internal. And I think that's key. You know, you talked about us taking a holistic movement approach when it comes to setting a program for someone. We want to make sure that, you know, everybody's not built the same. Everybody's bodies don't move the same. Everybody's bodies have adapted differently throughout the course of their lives to establish their framework in which they're in right now. And so we have to meet them where they are. Same aspect in their pain. You have to meet them where they are. Okay, what's going on internally first? Are you fueling your body the right way? Are you getting enough sleep? Is it a stress response that's causing the inflammation? Maybe it's not just that, you know, you have pain in your elbow because your elbow's broken. You know, your doctor tells you to not lift anything over your head that's over 10 pounds. Well, let's take a step back and let's see what's going on first. That's something that your patients have all spoken highly about, is the holistic approach that you take. And it's something that we pride ourselves in at the gym as well, is creating that holistic approach to make sure we're meeting everybody exactly where they are, instead of giving everybody a generalized framework of what fitness should be.
I feel like, too, that is not something that I always did, especially as a new grad, because when you're first starting out practicing, you're just trying to check the boxes. You're like, okay, did I get everything? What am I missing? What's wrong with them? And what do I do? And it was like panic mode all the time. But you get past that, and so then I think that's where I've started to question the patients that come into me, especially if it's been an issue that's been going on, lingering on and off for years, or if it's a chronic pain situation. I've I'm like, okay, this probably isn't, just an overuse injury or just arthritis, or maybe it is arthritis, but why do you have the arthritis? Because is it a lifestyle issue that you've had for years and now you do have, inflammation or, whatever. A lot of my patients come in and they have 5 or more comorbidities, right? They have arthritis of some sort, osteo or rheumatoid, or they have diabetes, or they have, cholesterol issues or heart issues, cardiac history, whatever. So lately I've been considering all of those things and how that might look from like a blood work standpoint and why that might be contributing to their pain. And I explain that to them, and some of them are just like, that's exactly how I feel. And I'm like, yeah, I think that's why you feel that way. Well, no one's ever said that before. My doctor's never said that, this could be out of range and I feel this way because of that. And I'm like, well, I didn't say that either probably a year ago, but I've tried to take this more holistic approach because I would have people walk out the door and they were still in pain, and especially chronic pain people. Like, it's so hard to treat them. And most of the time they're coming into you and they've been through physical therapy before and they're not hopeful that you can help them. And they need help from more than just an exercise standpoint. And if you're not addressing that, you're really doing them a disservice, or you're just like I was before, probably just not realizing that it's more than just a, exercise issue or lack of exercise, over exercise, whatever.
That's true. Because we have people that they meet one-on-one with us to possibly start a membership with personal training. And they're like, I tried physical therapy and what she did not work. And it's because, in the same breath, I tried a personal trainer before, I tried a gym before, nothing works for me. And it's the same thing there. In an industry where there's such variety, same thing can be said about doctors, same thing can be said about lawyers, same thing can be said about teachers where we're sending our kids to. There's a group of people that truly care and invest themselves in this. And then there's, sadly, probably a majority group that is just lacking behind, or just because life gets them in such a busy stage, they just can't catch up because they're not able to put enough time into this.
Yeah, I don't know if I think for some people they don't want to pursue that education, and that's fine. I mean, if you're keeping up with, what works for certain diagnosis or what types of exercise or nutrition works for people and you're seeing results, that's fine. But I just feel like, I don't remember what I was going to say. I feel like there's good and bad providers everywhere. So I feel like if you're trying to keep up with the latest research, your patients are going to get better faster. And so that's what I try to do. But again, it's more, especially if you work in like traditional medicine setting, like your doctor is probably seeing 30 people a day, especially an orthopedic doctor, and they don't have time to spend more than 5 or 10 minutes with you. So do you think they have time to go home and keep up with the, look at your blood work and keep up with every research article and go to a bunch of seminars? No, they don't. And neither do your therapists who aren't helping you get better, that see, 2 patients an hour for 9 to 10 hours a day. Like, that's really hard to do, but, some people are going to prioritize that in their free time, and they're going to see better results.
That's true. It's everyone needs someone to invest in their relationship, and that helps it grow as far as the quality of their experience with you and with me, but also the quality of their results over time. Because if they have a relationship with us, then they're not afraid to ask those questions, but then they're also going to keep tabs on us when, they're no longer seeing you for care. You have many people who follow you on social media, and you're constantly putting out the information that you continually absorb over time, things that have worked out for you. And it's just cool to see the reactions, the responses that you get that verifies that what you do matters. and that who you are matters even more, because they are feeding off of this information that you're providing them, and it's not even, you're not charging for it, so I really appreciate about that about you. Once again, I know I'm biased because we're married, and the marriage counselors would tell me I have to say things like this, but I truly admire the way that you treat your patients, but also the way that you create relationships with them overall, the interactions that you have with people, and the way that you're able to connect the dots. So I really appreciate you coming on against your will on this podcast, but allowing us to open up a conversation. That's all we wanted episode 1 to be, was just a conversation about why we're doing this, why we're in this, why Allie went into physical therapy, and her core beliefs behind what she does, why I went into personal training, and why I stayed with Results by Design Fitness.
You didn't tell your story.
Well, we might save that for another day.
No, it's time to share why you went into personal training.
Yeah, so, well, didn't think I was going to be...
I'm the host.
Oh, okay. We're switching roles right here. Yeah, so...
I am the captain now.
I like you, I grew up playing sports. And I always found attachment through the relationships I built with teammates, the relationships I built with coaches, and the interactions, the following you could gain by excelling or working hard and staying humble on the field and or on the court. Played basketball for a little bit too until I figured out how short I was going to be. But through college, I found that baseball was my passion. Baseball was my ticket to be able to play at the next level and get my education. And I didn't really know what I wanted to do. I went into education, thought I was going to be a teacher, kind of got talked into it by one of my professors that I had. I knew I had some interest in some health classes. I knew I had some interest in some business classes. And it was actually one of my health professors that said, "Hey man, you make a great teacher, and you play baseball, so maybe you could coach one day as well." Thought that was a great idea until I actually got into the field and decided, you know what, teaching is not right for me. Going into my sophomore, into my junior season, actually, from my sophomore into my junior season, I had maybe had 7 at-bats my entire college career, and just wasn't satisfied. And I knew that I was less athletic than the people that were on the field in front of me. I knew that I wasn't as strong as the people that were on the field in front of me, and something was missing. So I decided to work out. Didn't really know what I was doing. Actually, when I came on to campus for my junior season, I had built a little bit of a conditioning component and a little bit of strength over time. Met a strength and conditioning coach. He actually was an assistant coach, but he had a little bit of a background in creating programming. And that was the first time that I actually saw programming at work. Something to follow, a plan just for me, something that I can track my weights over time. I had never tracked loading before. And I took this program and I did it religiously, and I saw tremendous results. I had built up a little bit just through guessing my way through. Mm-hmm. But when I actually had an assessment and went through a process of following a program, that's when I truly saw results. Actually had a fantastic junior season, was second team all conference. Going into my senior year, we went to the World Series my junior year, so we were excelling as a team. Went to the World Series again my senior year, had an absolute blast, and actually, got to be a significant part of those teams. And I saw what fitness was able to do for me and decided that was going to be my field, my passion. Trained some people out of my garage shortly after graduation. There was a situation at my former high school where a coaching vacancy appeared, and I volunteered to take that job. So I was an assistant coach at my alma mater, my old high school, for a season, and trained some of the kids out of my garage there, and trained some of the local neighborhood moms and dads out of my garage, wrote them programs, and actually experimented with what worked for me. Long story short, my dad, when I was on the job search for my first personal training job, my dad knew of someone from our hometown that had moved to Louisville and had opened a gym with his with a partner. It told me to reach out to him. I thought, sure, can't hurt anything. So emailed them, gave them my resume, which was nothing, by the way. Hey, I've trained a couple kids out of my garage. You want to hire me? And sent in the resume. He decided to have a phone conversation with me, liked it over the phone, decided to invite me for an in-person interview. I showed up in a button-up shirt and khakis and dress shoes.
Fancy.
They thought I was a realtor. Judy, I know you're going to listen to this. Coach Judy was there at the time, and part-time with us, and she informed Matt, which is one of the owners at Results by Design Fitness, and Scott, the other owner, that the realtor was here and he was taking pictures. I was taking pictures of the equipment. I was taking pictures of them. One of the members, Missy, love you. Missy came up and put her arm around me and said, "Welcome." And I'm like, "Oh, this is cool." And you know, one member after the next, I saw their conversations with one another. I saw the way Matt and Scott interacted, almost like brothers. And now that, you know, I've been there for 6 years, I know that they are very much so like brothers in more than one side of the equation. They love like brothers, they fight like brothers, and they are competitive like brothers. But I saw that component of things as well. I saw the way that the coaches, it was Sarah and Coach Sarah and Coach Judy at the time, the way they interacted with the members there. And it just set that place apart from anywhere else I'd ever been. And, you know, I sat down the interview not knowing how it was going to go. I just gave them my best pitch of the person that I was, because my resume did not speak volumes for what they were looking for. They decided to give me a shot, and here we are 6 years later. Fell in love with the place, fell in love with the members, fell in love with the community that creates. Just a fantastic community. That would be the top thing that I recommend if you are struggling with fitness, if you're struggling with a healthy lifestyle. You must find community. Failure happens in isolation. Success only happens in community. And from a fitness and health aspect of my life, success has happened in that community. From a career and knowledge and growth standpoint, success has happened in that community. From meeting the woman of my dreams and getting married, success happened in that community. Mm-hmm. So I'm very thankful to be a part of Results by Design Fitness. You know, obviously their Results by Design Fitness, RXD, is bringing you this podcast, Live Healthy Louisville. And that's my story, and I'm sticking to it, and I'm sticking with it because I love this place. I love the city that we live in. I love the people here, and I want to help impact as many people as we can over the years. And you know, if one person hears this podcast and it changes their life, that's all that matters. You know, impacting one person at a time is what we're going to try to do. And so I appreciate you making me tell my story, but didn't know I was going to get all emotional up here on episode 1, but I just wanted to kind of set a baseline. But now now they know that story. So
there you go.
This is the thing. She's always bringing out the best in me. So there you go. You got a story that I didn't plan on today. It's not in my notes over here to my left.
I think it was fundamental for this episode, so it's a good thing
I appreciate you throwing that in there. I appreciate even more you being on here, and treating people the way that you do, and helping me grow as a coach and helping people grow as a community when it comes to fitness and creating a healthy lifestyle. Guys, thank you so much for listening to episode 1. I just want to close by inviting you to like, share, and subscribe to this podcast. You can find us on any of the podcast outlets. You can find us also on YouTube. Make sure that you hit that subscribe button so that you will know when our next episodes come out. You can follow Allie on social media. Like I said, she puts out a tremendous amount of information for free on her Instagram account. It's Allie.a.harper. Allie.a.harper. I think I had that right.
It sounds right.
At Allie.a.harper. She shares pretty much everything that we do, and we try to help create sustainability in our life. You can also follow our podcast on Instagram at Live Healthy Louisville. That's it. No one else had that that tagline, so I was happy to snatch that up. But thank you guys for listening to episode 1. I want to close by saying thank you, Allie. Thank you all for listening, and I love you too.